Voucher checks are commonly used for A. Payroll, B. Payment collection, C. Internal billing, D. Cycle billing. Answer A. Payroll. From which of the following is agar extracted? A. Fungi, B. Bacteria, C. Algae, D. Protozoa. Answer C. Algae. When addressing an envelope, the word confidential should be placed A. 2 lines below the address, B. 2 lines below the return address, C. 1 line below the address, D. 1 line above the city and state. Answer B. 2 lines below the return address. The ledger provides up-to-date financial information pertaining to which of the following? A. Pharmaceutical representatives, B. Insurance companies, C. Physicians, D. Patients. Answer D. Patients. Which of the following abbreviations is used in a prescription to indicate that a medication should be taken orally before meals? A. POAC, B. POHS, C. POQD, D. POPC. Answer A. POAC. A hereditary disease that causes copper accumulation in various organs is called A. Gout, B. Lyme disease, C. Wilson's disease, D. Crohn's disease. Answer C. Wilson's disease. Which of the following is the most appropriate medical record classification for a deceased patient? A. Inactive, B. Closed, C. Active, D. Transferred. Answer B. Closed. A microbe that lives only in the absence of oxygen is called a N. A. Cilia, B. Flagella, C. Virus, D. Obligate anaerobe. Answer D. Obligate anaerobe. Medicare Part C involves which of the following? A. Prescription drugs, B. Hospitalization, C. Private health plans, D. Indigent people. Answer C. Private health plans. Which of the following is the most appropriate initial action for the medical assistant when a patient is referred to the medical office? A. Determine the urgency of the patient's appointment, B. Schedule an appointment for the patient in 1 week, C. Discuss the case with the referring physician, D. Ask the patient for more information about his or her insurance coverage. Answer A. Determine the urgency of the patient's appointment. Which of the following is a safety hazard in a medical office? A. Dosimeter, B. Lead apron, C. Aneroid sphygmomanometer, D. Mercury thermometer. Answer D. Mercury thermometer. Antiemetics are indicated for which of the following conditions? A. Diarrhea, B. Seizures, C. Vomiting, D. Congestion. Answer C. Vomiting. The placement of the subject line in a letter should be in the A. Special notations, B. Closing, C. Heading, D. Opening. Answer D. Opening. Which of the following is used to indicate that a patient's medical record is stored in 2 locations? A. Cross-reference guide, B. Color coding, C. Tickler file, D. Out guide. Answer A. Cross-reference guide. Which of the following is the most appropriate method to remove sterile forceps from a sterile package? A. By the tip, handles up, B. By the hinged joint, C. By the handles, tip up, D. By the tip, handles down. Answer D. By the tip, handles down. The process in which molecules, ions, or particles move from an area of higher concentration to an area of lower concentration is known as A. Diffusion, B. Filtration, C. Osmosis. D. Pinocytosis. Answer: C. Osmosis. Which of the following is the correct spelling for the term that means characterized by an exaggerated reaction to an antigen or toxin? A. Anaphylactic. B. Anaphylactic. C. Anaphylactic. D. Anaphylactic. Answer: D. Anaphylactic. The Occupational and Safety Administration, OSHA, requires that healthcare workers be tested annually for which of the following communicable diseases? A. Epidemic parotitis. B. Hepatitis B. C. Tuberculosis. D. Rubeola. Answer: C. Tuberculosis. Which of the following is an instrument that measures and records the volume of air that moves in and out of the lungs? A. Spirometer. B. Electrocardiogram. C. Tonometer. D. Spirogram. Answer: A. Spirometer. Which of the following actions by the medical assistant is most likely to protect the physician if a caller to the office were to take legal action? A. Answering all calls promptly. B. Using technical terms on the phone. C. Avoiding lengthy phone conversations. D. Proper documentation of calls. Answer: D. Proper documentation of calls. Which of the following is a hereditary disorder of clotting factors? A. Poikilocytosis. B. Pernicious anemia. C. Polycythemia. D. Hemophilia. Answer: D. Hemophilia. In an electrocardiogram, what does the QRS complex represent? A. Depolarization of the ventricles. B. Repolarization of the atria. C. Repolarization of the ventricles. D. Depolarization of the atria. Answer: A. Depolarization of the ventricles. The gallbladder is normally located in which of the following abdominal quadrants? A. Left lower. B. Right lower. C. Right upper. D. Left upper. Answer: C. Right upper. Non-absorbable suture material is used for which of the following types of tissue? A. Nerve. B. Muscle. C. Fascia. D. Skin. Answer: D. Skin. Which psychologist believed that as people age, they also go through psychosocial changes? A. Kubler-Ross. B. Maslow. C. Erikson. D. Jung. Answer: C. Erikson. Which of the following types of filing systems requires a cross-reference file? A. Numeric. B. Alphabetic. C. Subject. D. Geographic. Answer: A. Numeric. The plan that covers spouses of veterans with permanent disabilities is called A. TRICARE. B. CHAMPUS. C. Blue Cross and Blue Shield. D. CHAMPVA. Answer: D. CHAMPVA. The Central Processing Unit, CPU, is a type of A. Motherboard. B. Microprocessor. C. RAM. D. ROM. Answer: B. Microprocessor. Which of the following is an example of a medical aseptic technique? A. Use of a disinfectant. B. Surgical scrubbing. C. Autoclaving with steam. D. Gas sterilization. Answer: A. Use of a disinfectant. A patient scheduled for which of the following services is most likely to need the longest appointment time? A. Postoperative visit. B. Complete physical examination. C. Prenatal checkup. D. Annual pelvic examination. Answer: B. Complete physical examination. Which of the following information provided on a patient registration form is demographic information? A. Name and address of referring physician. B. Effective date of insurance policy. C. Post-surgical history. D. Patient's place of employment. Answer D. Patient's place of employment. Disorders that involve an apparent, abrupt, and repeated shifting from one personality to another are referred to as A. Personality. B. Dissociative. C. Panic anxiety. D. Obsessive, compulsive. Answer A. Personality. The physician uses 6 packs of 5 to 0 sutures daily during a 5-day workweek. One box of sutures contains 32 packs. How many boxes of sutures are ordered each month? A. 2. B. 3. C. 4. D. 5. Answer C. 4. If a fracture is at the distal end of the tibia and fibula, it is called A. Wilson's fracture. B. Pott's fracture. C. Greenstick fracture. D. Comminuted fracture. Answer B. Pott's fracture. Which of the following combining forms is matched correctly with its meaning? A. Hypo-/above. B. Latero-/below. C. Antero-/back. D. Peri-/around. Answer D. Peri-/around. On a urinalysis reagent strip, infection is indicated by the presence of which of the following? A. Urobilinogen. B. Leukocytes. C. Bilirubin. D. Ketones. Answer B. Leukocytes. Dry scaling and fissuring of the lips is called A. Xerosis. B. Xanthoma. C. Keratosis. D. Chylosis. Answer D. Chylosis. Which of the following is a bactericidal antibiotic? A. Cephalosporin. B. Aminoglycoside. C. Tetracycline. D. Vancomycin. Answer C. Tetracycline. The artificial breaking of adhesions of an ankylosed joint is known as A. Arthrochalasia. B. Arthrodesis. C. Rachis. D. Spondylitis. Answer A. Arthrochalasia. Which of the following may result from sunburn over time? A. Sebaceous nevus. B. Epidermal nevus. C. Kaposi's sarcoma. D. Malignant melanoma. Answer D. Malignant melanoma. Which of the following should replace a patient's medical record when the record is removed from the filing system? A. Post-it note. B. Index card. C. Out guide. D. Cross-reference card. Answer C. Out guide. Which of the following is not a computer input device? A. Trackball. B. Printer. C. Mouse. D. Keyboard. Answer B. Printer. Which of the following is an advantage of metered mail? A. Traceable. B. Insured. C. Faster processing. D. Less expensive. Answer D. Less expensive. Which of the following is a chest pain symptom that results from a temporary loss of oxygen to the heart muscle? A. Intermittent claudication. B. Angina pectoris. C. Atrial fibrillation. D. Carotid artery bruit. Answer B. Angina pectoris. What is the term for a court order that requires a witness to appear in court with a patient's medical record? A. Subpoena duces tecum. B. Cafacit per alium. C. Residential ipsa loquitur. D. Respondeat superior. Answer A. Subpoena duces tecum. When scheduling appointment, which of the following should be considered? A. Demographics. B. Cancellations. C. Analyzing patient flow. D. Inactive files. Answer C. Analyzing patient flow. Which of the following terms best describes the awareness and insight one person has for another's feelings and emotions? A. Sympathy. B. Sensitivity. C. Apathy. D. Empathy. Answer: D. Empathy. When a false statement is made under oath, it is referred to legally as A. A verdict. B. Perjury. C. Libel. D. Slander. Answer: B. Perjury. Which of the following medical terms is spelled correctly? A. Proteinuria. B. Osteoarthritis. C. Myelogram. D. Cholecystitis. Answer: A. Proteinuria. Retinol and carotene are referred to as which of the following vitamins? A. Vitamin K. B. Vitamin D. C. Vitamin A. D. Vitamin E. Answer: C. Vitamin A.